What is the goal of the literature review? Explanation. The goal of a literature review is to establish what is already known about a topic and, crucially, to identify what is not known, the gap in the literature. This provides the justification for conducting the new study or, in the case of a standalone systematic review like this one, to synthesize the best available evidence on a specific question. Evidence from the article. The goal is explicitly stated in the final paragraph of the introduction and reinforced in the conclusion. From the introduction, this systematic review assesses the effect of the COVID-19 pandemic on the mental health of postpartum women, with a focus on the risk factors during the pandemic that increased levels of depression in new mothers. From the abstract/introduction. Our systematic literature review scope is to identify the risk factors and predictors for postpartum depression, PPD, and describe the steps that should be taken to help postpartum women. How did the researchers ensure they found the largest number of relevant articles? Explanation. Researchers ensure a comprehensive search by using multiple academic databases and a wide range of search terms, keywords, related to their topic. This casts a wide net to capture as many potentially relevant studies as possible. Evidence from the article. This is detailed in the methods section under literature search. Multiple databases. The databases PubMed, Scopus, Google Scholar, and Embase were searched. Broad search terms. By using the following terms: COVID-19, SARS-CoV-2, coronavirus, postpartum depression, postpartum depression lockdown. How do the authors reduce bias in the selection and review of the articles? Explanation. Bias in a systematic review is reduced through methods like having multiple reviewers independently screen articles to ensure consistent application of criteria and formally assessing the quality of the included studies. This prevents the reviewers' subjective opinions from influencing which studies are included or how their findings are weighted. Evidence from the article. The article describes 2 key steps to reduce bias in the methods section. Independent screening by multiple reviewers. The titles and abstracts of all records were reviewed to determine if they met inclusion criteria. Authors S.U. and S.J. screened all abstracts and full text for eligibility. Later, 3 reviewers, S.U., E.G., W.S., independently extracted data. Formal quality evaluation. Quality evaluation was achieved by using criteria set out by Lincoln and Guba, 1985. Each study was evaluated on the degree of credibility, transferability, dependability, confirmability. This process was done independently by 4 different authors. What is the advantage of reporting the studies by time period? Explanation. Reporting findings by time period, e.g., 1 week, 1 month, 3 months postpartum, allows the reader to understand the trajectory of postpartum depression. It shows how the prevalence of PPD might change over time, highlighting when mothers are most vulnerable and whether symptoms are persistent or resolve on their own. Evidence from the article. This is clearly demonstrated in the results section under Prevalence of PPD period. The authors break down the prevalence data based on the timing of measurement. Studies suggest that 14.8% to 40.7% at less than 3 months, 27.4% at 1 week, 38% to 44% at 1 month, 30% to 39% at 4 to 12 weeks. This allows them to draw a crucial conclusion. Overall, these findings suggest that at any time point between 1 week and 5 months postpartum, about 27% of mothers diagnosed with PPD still meet criteria for depression. What is the level of evidence provided by this article from the evidence pyramid? Explanation. The evidence pyramid is a hierarchy that ranks study designs based on their ability to minimize bias. From bottom, lowest evidence, to top, highest evidence. It typically includes expert opinion, case series, case control studies, cohort studies, randomized controlled trials, RCTs, and at the very top, systematic reviews and meta-analyses. This article is a systematic review, which is the highest level of evidence for a question about risk factors. Evidence from the article. The article defines itself as a systematic review from the very beginning. From the title, a systematic literature review. From the abstract/methods, we conducted a systematic search. From the methods, literature review related to postpartum depression was examined through a search of peer-reviewed articles and followed PRISMA guidelines. PRISMA is the recognized standard for reporting systematic reviews. How is the literature review linked to practice? Explanation. A literature review is linked to practice when its synthesized findings can be used to inform clinical decision-making, guide policy, or develop interventions. The authors must explain how their summary of the evidence translates into concrete actions for healthcare providers, policymakers, or other stakeholders. Evidence from the article. The link to practice is woven throughout the discussion and conclusion sections, where the authors translate their findings into actionable recommendations. For clinicians, screening. Health workers may conduct early screening and interventions for postpartum women who are at an increased risk for postpartum depression. New mothers should be encouraged to discuss their mental state and seek help. For policymakers/healthcare systems, observing these challenges and incorporating changes in our healthcare system can serve as guidelines for incidents like these in the future. It is also important to strengthen the knowledge of ways to improve maternal health services during the pandemic. For patient support, patients should also be advised to set up different pathways of receiving support. Virtual meetings or support groups that could include friends, family, or even other new mothers. From the abstract/conclusion, this review urges the need to design adequate interventions for this vulnerable population to prevent negative consequences of PPD. PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analyses. It is an evidence-based minimum set of items designed to help authors transparently report why and how they conducted a systematic review and what they found. Think of it as a standardized checklist and flow diagram that ensures a systematic review is reported clearly, completely, and with enough detail that others could replicate the process. When the authors state they followed PRISMA guidelines, they are signaling to the reader, and to you, the student analyzing the paper, that their review was conducted according to the highest, internationally accepted standards for this type of research. How did they ensure they found the largest number of relevant articles? PRISMA encourages a comprehensive and transparent search strategy. How do they reduce bias? PRISMA requires a structured process for study selection, data extraction, and quality assessment, like the Lincoln and Guba criteria they used and the independent reviews by multiple authors. What is the level of evidence? Adherence to PRISMA is a hallmark of a high-quality systematic review, which strengthens its position at the top of the evidence pyramid. It shows the review was done rigorously and systematically, not just as a simple narrative summary.